Hi there, this is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. This particular video is going to be called The Long-Term Goals of Aphasia and Apraxia Speech Therapy. Okay, so isn't that interesting? The long-term goals. Well, what is a long-term goal? Well, a long-term goal is a goal that's approximately anywhere from 1 to 5 years out. Now, some people may define it in other ways, but the way I look at it, and from what I've studied and read about long-term goals, it's about from 1 to 5 years. So you might ask, like many people, or if you're a caregiver, or even if you're a person with aphasia, you might ask, well, how long is it going to be until I recover my speech? Now, there are a lot of people who think that spontaneous recovery is going to do it. Now, what's spontaneous recovery? Spontaneous recovery is the ability to recover from a problem without treatment. And one of the things that has enabled me to really have an understanding of aphasia and long-term goals is the fact that since I've practiced speech-language pathology for 5 decades now, I've had the opportunity to see and to really experience how long these problems take to get significant improvement. And there is so much non-knowledge about how long it takes to recover. So my suggestion is if you have a severe to profound aphasia and apraxia, then you've really got to look at a long-term goal of recovery from 1 to 5 years minimum. Now, one of the things that occurs with many people is that they may work with a therapist who recommends an electronic device, which of course we know already doesn't improve speaking. What it does is it's a speaking substitute, but the people who try to encourage use of these devices, they say, well, it'll help improve your speech, but it doesn't improve your speech. You might say the words after the voice in the machine, but it's not about talking, it's not about conversation, and it's not about how talking occurs. Talking occurs between two people when they communicate. And so if a device does not deal with that, then you're wasting time. So now, if you have a long-term goal of recovery from aphasia or apraxia, one of the first things you have to do is put a time frame around it. And, there are a lot of people say, well, I want to be better in a month, or I want to be better in 6 months, or I want to be better in a year. Now, this is for people who have severe to profound problems. It's not going to be 6 months. It's not going to be a year. Believe me, it's going to be years. But it's possible to make significant recovery in years. And you've got to look again at a time frame of approximately 1 to 5 years. And probably more like 3 to 5 years. And the other thing you have to keep in mind is that for many people, having a goal that takes that long, they can lose interest very easily. Because anybody who's got a goal and they know it's going to take them 3 to 5 years to do, well, sometimes they lose their motivation. But yet, if you're a student and you want to specialize in architecture or chemistry or speech pathology or medicine, you know that you're looking at a long-term goal of literally years. So there's no real difference now between the amount of work that it takes to learn a craft or to study architecture or chemistry or biology or medicine or any of those subjects take a long-term goal. And one of the first things that you have to do to achieve a long-term goal is you've got to see it. You've got to imagine it. You've got to really take a look at what your life would be like having improved talking again and not being ignored or not being talked to, because people are afraid to talk to you because they know you have trouble talking, so they want to avoid talking to you or a loved one. And that's what happens with many families and many friendships. They may have a friend for years and years, but if you have a stroke, those friends come around for a little while after you have your stroke, but then after a short period of time, they kind of disappear out of your life. So just remember now that aphasia and apraxia, they require a long-term goal. A long-term goal is anywhere from 1 to 5 years. But if you've got a severe to profound problem, you're really looking at 3 to 5 years minimum. And that's how long it takes to get the speech functioning again. Now, it doesn't mean necessarily that it's going to be like it used to be. It's not going to mean that your speech is going to be normal, but it's going to mean that your speech can be functional. And functional means that you're able to use your speaking to basically communicate what you need to say, your basic statements and what you need to basically say to other people. And for others, they may need standby assistance for a while because they're able to talk, but occasionally that they get into a situation where they'll forget a word or they'll have trouble constructing the thought that they want, and it's very helpful then to have a caregiver at their side who can maybe help them out. So long-term goals, 2 to 5 years, that's what you've got to realize. And what the most important thing to do is you've got to imagine 5 years from now being able to communicate again, being able to communicate with your children or your wife or your husband or your neighbors or friends or anybody for that matter. But it's probably going to take that long, and it'll only take that long if you find an expert to help you out. Now, there are a lot of people out there today who aren't really trained in the methods to help people talk. It takes, believe me, it takes a lot of years to develop an expertise for that. So find an expert, hang out with the expert, know in the back of your head that it's going to take you anywhere from 2 to 5 years, and make sure that that expert is going to be around to help you out so that the long-range goal can be accomplished. Because sometimes you can start out with somebody really good, but that person may move or that person may have different challenges that cause them to relocate. And when that occurs, it's difficult to find another therapist. It's kind of like a lot of people who are looking for a wife today or a husband today, especially with the situation in the country. It's very, very difficult to find someone. And then once you find someone, it's very difficult to imagine that they're going to be there for the long haul. So those are the things you want to think about as far as long-term goals with aphasia and apraxia therapy. This is Mark Ittleman, speech-language pathologist. I hope this information has been helpful. If you've liked our video, please give us a thumbs up and subscribe to our channel. And beneath the video, if you click on the title, underneath the video are a bunch of links to our Facebook page, our YouTube page, our website. And of course, we have books that we've written to help people with aphasia and to help people with apraxia. We also have a video course for people who want to study this, so that you don't have to go back to college or anything like that. You can study the video and read the books, and that'll give you a good understanding of aphasia and apraxia, and will also give you techniques that you can use to help your loved one get better. So this is Mark Edelman, speech-language pathologist. We hope that you have a good day today, a good week ahead, a good month ahead, a good year ahead, and of course a good lifetime ahead. So have a great one, and we hope to see you. Okay, bye-bye now.